Thank you so much, everyone, for taking the time to join us today from the Legislative Building in Regina. We have Health Minister Jim Reiter, Chief Medical Health Officer Dr. Saqib Shahab, and on the phone we'll have SHA CEO Scott Livingstone. We'll start with some opening remarks and then go to questions. Minister Reiter.
Good afternoon. Thank you for joining us. Today we are reporting 67 new cases and 53 more recoveries, giving us a total of 666 active cases in Saskatchewan. As you know, Saskatchewan has seen some higher case numbers over the last number of days, and we are likely to see these types of numbers in the days ahead. Many of our cases continue to be linked back to recent super spreader events, private gatherings, and small outbreaks throughout the province. We need to remember that while cases can be linked back to events like these, eventually second and third generation transmission will inevitably result in community transmission. I know the overwhelming majority of Saskatchewan people are doing their best to follow all the good advice and direction provided by Dr. Shahab and his team. Where we get into trouble is when people step outside of that advice and direction. There have been some instances where the rules were not followed, and this has led to some outbreaks. These have been the result of a few people not following the public health orders and guidelines. So we need to be careful. We need to be vigilant. We need to keep limiting our gathering sizes, keep physical distancing, keep washing our hands often, wear a mask when appropriate, and if you're feeling sick at all, please stay at home. When we're feeling a little under the weather, we're used to just powering through it and still going to work and going about our daily lives. But we just can't do that now. Don't go into work, don't go to school, don't go shopping, don't go to a friend's house. We've seen a number of examples how one infected person at the wrong place at the wrong time can quickly turn into dozens of new cases. The government of Saskatchewan and the Saskatchewan Health Authority remain vigilant and mobilized. Our goal continues to be maintaining capacity in our healthcare system and ensuring we protect our health and long-term care facilities. When we're monitoring our capacity in the system daily, and while we're not there yet, the SHA may need to reprioritize procedures and surgeries if necessary. The SHA continues to work towards establishing a 6-month supply of PPE based on projected demand. So let's all keep working together and make sure we're doing all the things we need to do to keep those around us safe. That's how we'll keep our case numbers low and manageable through the fall and winter. Dr. Shahab?
Thank you, Minister. So I'll first just go over some case numbers and trends, and then over some key things to watch for over the next week. So as the Minister said, we've had 67 new cases today, and over the weekend we had over 2 days 138 cases with 78 on Saturday. And then since Monday, about 179 cases, and we're at 22,908 reported cases, and like the Minister said, 666 active cases. When we look at active cases and recoveries, they're kind of balancing out, because as our case numbers started rising, initially we had less recoveries, more active cases, but as they've leveled out, there's almost balancing. And when we look at trends, because our cases fluctuate up and down, our 7-day average case rate increased from an average of 47 new cases over a week, October 21st, to 59 new cases averaged over a week, October 27th. And the case rate per 100,000 went up from 3.9 new cases per 100,000 last week to 4.8 new cases per 100,000 this week. So again, these numbers kind of let us compare also with other provinces and other parts of the world as well, and gives us a week-by-week trend, because I think that's really important given our fluctuations on a day-by-day basis. And the other very important thing is that our overall test positivity rate is 2.3% in Saskatchewan. So again, as you know, it's been below 1 for many months, and then it was between 1 and 2% 2 to 4 weeks ago, and now it's crept up to about 2.3%. So again, not as high as some other jurisdictions, both in Canada and obviously much lower than other parts of the world, but certainly something we have to watch very closely. Our testing numbers remain high. We had record high testing this week, but our test positive rate is trending upward slowly. And if you look at specific jurisdictions, our test positive rate 2.3% overall in Saskatchewan, but it is 3% in Saskatoon, 3% in the Prince Albert area, 2% in Regina. So again, if you look at our map, we are looking at test positive rate by various geographies, because that can have an impact on if there's any specific concerns in a specific part of the province. And we don't just look at new cases and active cases. We look at test positive rates and other exposure settings as well, which we've spoken about in the past. Now, looking at what we need to watch out for the next weekend, we have a big weekend coming up with Halloween, and people are planning, events with their children, with their family, planning to go out, for example. And we want to make sure that we enjoy this weekend safely as we can, following all the guidelines that have been published for Halloween and for restaurants and bars and nightclubs. I think that's really important. We obviously are seeing many private gatherings being organized as well. So again, the limit is 15 for private gatherings in the home. But again, stick to your consistent friends and family and try to keep it as safe as possible, even if they are within, people you're inviting are within your extended household. Still try to keep it as safe and as small as possible. We don't really want to see another signal a week after Halloween, and we did see a bit of a signal after Thanksgiving, and certainly we don't want to see a large signal of increased case numbers a week or two after Halloween either, as much as we can prevent, because then that can set us up for challenges even going forwards towards the Christmas holidays. Now, for younger children, the forecast seems to be milder weather. So again, our guidelines remain as they are, where it's a weekend where, as a household, you can dress up and be outside, see and be seen. Try to stick to your own neighborhood. Go to a few houses who are participating, but follow the guidelines. Try to maintain the 2-meter distance if you choose to trick and treat. I think that's going to be really important thing for children. But again, we are supportive of those families wishing to do trick or treating to do that in a safe manner. For young adults, this is not the time this is not the weekend to be going to multiple restaurants and bars. If you do decide to go out, follow the guidelines that are on the Reopen Saskatchewan plan, and stay with your group that you're going to one facility. I think the aim is to go out and enjoy, and we've seen that if you follow the guidelines, restaurants and bars don't prevent transmission completely, but you can get a small cluster. But we certainly don't want to see a repeat of those mass transmission events that are happening. And that's why we're also issuing a public health order, which will especially, and it will be posted later today, which will especially focus on the larger venues like nightclubs, where we've seen situations where there was crowding and large transmission events, which really escalated the case numbers in Saskatoon especially, but throughout the province. And now a lot of those cases are secondary to those large transmission events. So we can see that once case numbers go up, you can have several weeks, because then you can have secondary transmission in close household contacts of the initial cases. And again, if you look at our Reopen Saskatchewan guidelines, they are very clear. Go in a group which can, for example, 6 people to a table. If in a bigger group, you have to sit at separate tables and don't try to pull tables together. It is important to go and sit at your table and avoid mingling, because that's how you can get multiple exposures. It's a really good idea if the establishments want to take your name and number, that at least one person should give a name and a contact number, because in case there's a transmission event, everyone who was there at a certain time or date can be contacted quickly to really start contact tracing very quickly. And of course, unfortunately, especially in the nightclub settings, live music, open mics, karaoke, dance floors, they really result in large transmission events, and they really can't happen. And businesses, including bars and restaurants, really need to encourage mask use in common areas. When you're entering, exiting any business, including bar, restaurant, obviously staff will be wearing a mask. But if you wear a mask while you're going to your table, that's always a good idea. And then at your table, you can choose to wear a mask till your food and drink come, and then take it off. But really, the aim of all this is, although it feels different, it may inconvenience you, is to minimize exposure to within a small group if it was to happen. And of course, don't go out if you're not feeling well. I think that is really important. Sometimes, there's a lot of peer pressure to go to someone's house or to go to a restaurant or bar because you've planned it for a long time, but if you're not feeling well, stay home. I think that's really important. And, we really have to comply as customers and as business owners to let, bars, restaurants, and other venues continue to operate. Because otherwise, if our case numbers keep rising and they are linked to specific settings, then, obviously, we need to look at further slowdowns and closures, which really you want to avoid, and you want to avoid fines as well. But then we all need to comply, and that, applies to bars and restaurants. It applies to other settings like gyms. We've had great success with gyms not being a source of transmission for the most part. We've had a couple of, transmission events. They were complying with the guidelines, but there were certain places where, people are congregating before and after using the gym. So again, those are things that it's not just the business owner's responsibility, it's all of our responsibility to maintain that physical distancing, prevent that crowding, before and after exercising, for example, in the gym, and, maintain that 2-meter distance from staff and other people using the gym at all times. And of course, sanitizing your hands, not going to exercise if you're not feeling well. And this really is a balance to, as the Premier said yesterday, to protect both lives and livelihoods. I think we do need to strike that balance in the face of increasing case numbers as much as we can. And finally, in Saskatchewan today, there are no geographic zones without cases. And most of the cases right now, I talked about some specific measures being taken for Saskatoon. In other settings, the cases are a mixture of, secondary cases to super spreader events that happened in weeks past. We can see those continuing for a while. It's, secondary transmission in household settings, in small social gatherings, even under 15. Occasionally there's a birthday party or other celebration, and transmission does happen. So again, stay home if you're unwell, or if you're hosting something and you don't feel well, or anyone in your household doesn't feel well, please cancel, and everyone should understand. And again, we should observe all our layers of protection. I've heard that recently people get upset if a business is asking you to wear a mask. We have to recognize that, you may be going in just for 5 minutes, but the staff and employees in a business are seeing hundreds, if not thousands of customers, and a mask protects you, but it also protects others. And so, I think we need to understand that we need to, protect each other. And if, many of our fellow citizens have been working on the front lines throughout the pandemic, and we've kept our numbers low, and we need to respect all measures and all layers of protection, including wearing a mask where required in an indoor public place. Thank you.
Thank you, Dr. Shahab. Thank you, Minister Reiter. We'll take our first question from the phone line.
We have Mark Melnichuk with Leader Post.
Hi there. My question is, we were just wondering what the effective reproduction value is for Saskatoon at the moment, as well as Saskatchewan more broadly, if you can give us that number. We've been hearing that in Saskatoon it might be as high as 4.
Yeah, I don't have the numbers with me right now. It has been fluctuating between 2 and 4. And we have to remember that, I talked about average case numbers. I talked about the test positive rate. The RT, or the effective reproductive, is another indicator we follow, but we can't follow it on its own. So I'll give you an example. So for example, in Saskatoon, let's say there were 3 super spreader events and the RT went to 2.5 or 3. That's one number. And then a week or 2 later, if due to those super spreader events, there were secondary cases in households, the RT may go to 4 because each person may infect 1 or 2 additional people, and then they are already isolated, and then the RT comes down. So it's not just the effective reproductive number on its own, it's also the transmission settings. So, in my view, even though the RT was initially lower, the super spreader events are very significant, and a week or 2 later, the RT did go up, but a lot of the secondary cases were close contacts of the initial cases. They were already isolating, and as they're already isolating, we hope that there will be less tertiary cases from those events, and the RT will, of course, also go down. But the RT has been high in Saskatchewan between 2 to 3 and has fluctuated between 2 and 4 in different parts of the province. We try to look at it for Regina, Saskatoon, the north and the south, so in 4 areas. But beyond that, obviously, we have active case numbers by 32 geographies. So I think it does fluctuate based on new cases, but the settings of transmission are also important.
Do you have a follow-up question, Mark?
Obviously, like today, we're hearing a lot about as it relates to Saskatoon because there's been so many outbreaks at bars. But the cases are also rising in Regina, and I was just wondering what are you attributing that steady rise to in Regina?
Yeah, so in Regina, it has not been so far linked to super spreading events, but there has been transmission, in the home setting. So, for example, there may have been an index case due to travel, interprovincial or international, and then in some settings, there are secondary cases in the household. And again, that's a reminder for all of us that all of us should make a plan that many of us could be become a case or a contact, and we should have a plan in our house that if someone becomes a case, for most people they can safely isolate at home, but how will they isolate, how will everyone else stay away? And if someone needs support like a child, who's the one person in the house who will support that a child or other one who may need a bit of support? And then for close contacts, if you've been named as a contact with the case in your household, or how will you isolate away from each other as much as possible? And if you've been named as a close contact due to an exposure outside the household, how will you stay home for those 14 days as a close contact, which you have to, in a way that if you were to become symptomatic while isolating, you are confident that you did not expose anyone else in the household. So I think we all made these plans in March, April, then we had summer. Now's the time to revise those plans and make sure that all of us have a plan to isolate at home in a way that we keep others in the household safe.
We'll take our next call on the line.
We have Alicia Bridges with CBC.
Hi. This first question is for Dr. Shahab. You said a couple of weeks ago that you would need to consider new measures when case numbers hit 60 daily, and we've now had that number several times. It's been even higher in Saskatoon. So, if this is such a concerning number, why didn't we see any response in terms of restrictions until after the election? So, was there a discussion about that timeline and when this was done, and why has it come so late and after the election?
Yeah, so, I'll maybe make a couple of points, and if Mr. Reiter has any comments. In my view, my recommendations are always based on the transmission settings and other metrics. So regarding, we had very clear guidelines for Thanksgiving, and for the most part, people observed Thanksgiving very responsibly. But there were a few instances where, individuals did go while symptomatic to more than one event of up to 15. There were multiple transmission events. But if you recall, we had reduced gathering limits for private homes to 15. So that was done, during the writ period, and that was an important step in my view to kind of slow down transmission events in the home setting. But even with 15, we need to take appropriate precautions. Secondly, we obviously had the 3 outbreaks in bar/nightclub type of venues in Saskatoon, and when those were investigated, we have seen that bars and restaurants in general have been very diligent with the guidelines, and it's been fairly low risk, not zero risk. When you go and sit at your table, have your food and drink served, and then leave and don't mingle. But in settings where that is not happening, that becomes an issue, and that's why the order is issued. And the order really is also especially for Saskatoon right now, and especially focused on the fact that we had heard just over the last couple of days that there were significant events and risks due to Halloween celebrations. So really it's to slow down, not prevent a lot of those events, but to slow them down in a way that you can still go to an event in a safer manner. So that's the recommendation at this time. And it applies to Saskatoon because that's where a lot of the larger clusters due to nightclub type venues have happened. Obviously, if we were to see that more broadly, further considerations may apply. But like I said, In Prince Albert and in Regina, the transmission really has not been linked to any specific sector. It's been more, in the household setting and workplaces. I think I need to emphasize that, we've had reports of large buffet-type lunches in workplaces. You can't have a buffet in a restaurant. You certainly shouldn't host those kind of lunch events in a workplace. And we've had multiple transmission events because, you should not have a buffet in the home if you've got 15 people. You shouldn't have a buffet time setting in a workplace, but that's where transmission is happening. So I think workplaces really need to revise their COVID plans. A third of our cases are in work settings. And, many workplaces have had very good protocols in place right from the beginning. Many had good protocols. They kind of relaxed over the summer. This is the time to really revise their protocols. And for workplaces, for some reason or another, maybe they were not customer-facing. They were just offices where you go and work. If they, for some reason, never developed those protocols, this really is the time. And, I've flagged that for the Department of Labor and Occupational Health and Safety, that really you need to comply with safety at work, and having a COVID protocol is part of that expectation.
You have a follow-up question, Alicia?
I do, yeah. So, these changes that you have announced today are only for nightclubs. So I'm curious about why they weren't extended to churches as well. Obviously, we've already had sort of one major super spreader event related to a church, even if that is a small minority, sort of if they broke the rules on that one occasion. Obviously, now we know the capacity for the fallout of that, of how many cases we can see from one event, even if it's someone who's not following the rules. So why not churches too? Why not change those restrictions to tighten things up and protect against super spreader events like that?
Yeah. So I'll give you my my opinion as of today, and that may be different 2 weeks from now. But we have had churches open, other places of worship open. We have had other events like live venues, like movie theaters, and I know they have slowed down or closed in other parts of Canada, but we have had that open now for several weeks. And for the most part, churches, places of worship have been extremely diligent. Many people who are vulnerable have continued to worship remotely or online, and many churches and places of worship have opened their services for online participation. In many cases, their congregations have grown actually to beyond what could even be accommodated when there were no restrictions. But beyond that, I think most places of worship have been very diligent, and we have not seen large clusters. And in fact, I still feel that if where we are at now, if there are super spreading events where obviously in some cases guidelines are not followed at all, that should not penalize an entire sector, whether it's a place of worship or a sporting rink or other settings. But this is something that we need to closely monitor, and I think it's all of our responsibility. It's the responsibility of the host, whether it's a place of worship or another setting, movie theater, live show, a sporting arena. The organizers have a responsibility, but then all of us have a responsibility when we go. We just cannot start crowding and mingling beyond our household. And as long as we all, are able to do that, hopefully we can keep all these venues open.
We'll go to the room. Morgan, do you have a question?
Yeah, I know you've addressed the mandatory mask question quite a few times, but when you reference the business owners that are struggling with maybe some kickback from patrons who didn't bring a mask or don't feel that they need to wear one, is there a scenario where the government would just make that decision across the board and just say, these are the rules for all businesses?
We've reviewed the guidelines throughout Canada, and I think we we really want this to be an expectation that we do in many settings where we're in a public place and not with our immediate household. So it should be something we do just as a part of routine right now in a pandemic, when we're getting on transit, when we're sitting in a taxi cab, when we're entering a retail location. I think it just should be an expectation. I think very few jurisdictions have made it mandatory, and I think So that's where, I think my position is at the moment. Obviously, if things continue to evolve, I think that is something that should be looked at. But I think it's just a small gesture that says, thank you for doing what you can to protect me, and I'm doing this to protect you. And I think it's just one of those small, simple things that we should all do. And we have to recognize also that, two things. One, we may be only going into business for 5 minutes, but the people who have been working in many essential and other retail locations ever since March, they have to help hundreds of people a day, and really we have to look out for each other in these settings.
Follow-up question, Morgan?
Yeah, I was also wondering, for my colleague who's working on a sports story today, the SJHL has been given the go-ahead to proceed with sort of a bit of a bubble season. Whereas some other sports like curling have different types of restrictions that don't allow them to have bond deals and things. So I was wondering if there's an explanation around the rules that allow the SJHL to proceed versus some other sporting events that haven't been allowed to proceed.
Yeah, I think a lot of these leagues, presented their plans, and then they were looked at by the business response team and by the Ministry of Health. I kind of looked at them as well. I think what we're trying to do is we're trying to support two things. One is the athletes and their team staff themselves. That we can't avoid all transmission if we want to go to work, go to eat in a bar or restaurant, play either in informal leagues like we've been playing all summer, or in more professional leagues. But we do want to reduce transmission risk among players and staff, so the guidelines speak to that. And then we've also seen that from the spectator side, there's a phased approach where currently the spectator limit may be as defined by the rink, but there is a cap on that. That may or may not expand given on overall transmission or how well we do. But again, we've seen that for larger settings like movie theaters, other live events, we have not seen any transmission and place of worship again. And again, it's because they're well organized and people who are going there are really complying with the guidelines. And we know that even here, that because we are complying with the guidelines, we don't expect to see a transmission event in this room as well. So I think that's the whole spirit of this, that we do want events, whether it's work or recreation, to continue in a safer manner. And we'll have to keep monitoring. If our community transmission rates become very high, then maybe it may not be as safe to have spectators or have sports events. But even if transmission events were to happen within sporting events, we'll have to see, is this something that has happened, but and can we learn from that, but not discontinue sporting events? Because for other sports that have been continuing in mini leagues, we have not seen transmission events, and from what I've heard, people have been very diligent. But as our community transmission picks up, I think we'll have to continue monitoring the risk of transmission versus the obvious benefit from engaging in physical activity and being able to go and see an event that you enjoy, whether it's sporting event or other events.
Take our next question in the room. Stephanie?
To the minister, and pardon me if this has already been asked, but since it seems that some of these outbreaks have been tied to businesses simply not following the rules and, having dance floors or too many people, are you going to be talking to your colleague or getting workplace health and safety to maybe be sending in more O&H officers just to make sure that these rules are indeed being followed and be a bit more proactive than just kind of finding them after the fact?
I haven't been having briefings over the last few weeks. I've kept in touch with my deputy, but beyond that, we pretty much left the operational side to officials. But it's a very good point. I'm planning on, we'll be starting briefings again next week. One of the issues I'll be raising with, and I've heard Dr. Shahab talk about this over the last few weeks, is as opposed to sort of broad brushing all industries, I think it's important that we do everything we can. Obviously, we ask for cooperation from businesses, but if there's cases of businesses that are sort of blatantly violating the rules, I think it's important that we're prepared to do what we need to do on the enforcement side. So I think to your question, we'll be having discussions at the briefing next week on what we need to do in that regard as far as staff available and things we need to do for enforcement.
Follow up?
Are you also going to be considering how to maybe send this message in a bit more targeted or aggressive way to younger people, like say a specific advertising campaign, because if we've seen, young people going out being the main driver of these recent outbreaks, is that trigger to you that, we maybe need to try and reach out to them a bit more and kind of drive this message home?
Yeah, I think on the education side, I think that's really important. So that'll be one of the topics we'll be discussing is, again, over the last few weeks, I'm not sure what sort of the plans are in that regard, but I'll be asking questions about that to see if they do have any plans to do that, because I think it's very important. As you said, the issue around the nightclubs, for example, generally speaking, that's transmission among younger people, and we need to impress on them the importance of following the public health guidelines, and that'll be part of the discussion.
We'll take our last question on the phone.
We have Britton Gray with CJME.
Britton, are you there? Operator, do we have another call on the line?
That's all the calls.
Perfect. Thanks, everyone, for taking the time. That concludes today's conference.